So today we are going to talk about taking care of your tummy tuck incision. Now, this is why we're doing this. You guys go to Miami, you go to Mia Aesthetics, you go to For You Beauty, whatever in Miami, right? All these different Miami places that do tummy tucks. Okay, it's one thing when you're getting a tummy tuck in New Jersey with a surgeon that is a private surgeon, that you're under their care. It's another thing when you're getting a tummy tuck in Miami where you're staying in a recovery house and they're doing all this crazy stuff and you have drains in, and then you come home with your drains with no directions. And then you come to me and you ask my lovely lady Alex in the office, oh, can you take out the drains for me? No. No. No one except your surgeon or a doctor, a medical doctor in an emergency room or a plastic surgeon is allowed to touch your drains. That is a medical device inside of your body. We are not touching that ever. So no, we don't do that. And we don't cut anything open. We don't squeeze fluid out of you. We don't do any of that stuff. So we're going to talk about tummy tucks in Miami. First thing I'm going to say is, yes, you're going to have drains. What is a drain for? I have a video specifically explaining what drains are for. If you don't know what they are or what they're for, go watch that video. But tummy tucks, when they have the drains and they send you home with the drains, usually if you're not staying long enough, which is like 2 weeks, which I would not recommend staying that long in Miami for aftercare. Oh, absolutely not. With that, they send you home. They say, oh, get it out after, however many days, right? Okay, so how that works is when it reaches a certain amount in the bulb or the drain, that's when you take it out. What's draining out of there is blood, not swelling. Not swelling. What is coming out of your drain is blood, not swelling. I'm going to say it one more time. It is not swelling. So by having a drain in, that doesn't mean you're not going to swell. That doesn't mean your swelling is going to be less. When doctors say, even out here, when doctors say, oh, well, you still have a lot of swelling, so we're going to leave your drains in. No, that's not what that's for. That's not how the lymphatic system works. That's not how swelling works. No, if they're keeping it in because you have a lot of blood coming out and stuff like that, that's different. Every doctor has their reasons. So whatever reason your doctor is leaving your drain in, that's fine. My problem is when they send you home with the Steri strips over your incision, all those little strips, and give you no care instructions, and drains hanging out of you with no care instructions, and they send you home in a binder, and you had lipo on your arms and your back, and nothing's getting compressed properly. So today, we're mostly going to talk about the Steri strips and taking care of your tummy tuck incision, which does involve drains, which is why I went on that little rant. Totally got off track. But, so, with a tummy tuck, right, you've got a nice big scar that has stitches, an incision with stitches, right? Sometimes they're dissolvable. Sometimes, depending on how much work, you have anchor stitches, either in your belly button, right, because you get a new belly button, in your belly button, or in the actual tummy tuck scar itself. Sometimes those need to come out. The doctor puts them in for a specific reason. Sometimes they're dissolvable, and they don't come out. They just dissolve on their own. My biggest point that I want to make in this video, what is a Steri strip? Okay, so different ways they close a tummy tuck incision with the stitches, and then they put that tape over it, right? Sometimes it looks like a mesh tape almost. Sometimes it's not tape, it's glue. Sometimes it's that paper Steri strip tape, which is like it's like it looks like paper almost. Sometimes it's like a brown color, like a Band-Aid color, but it's like paper almost, and it sticks to you. So how does a Steri strip work? Or how does like that little tape work? Okay, so it's like a tape. It's got adhesive, right? So you're stitched up, you're bleeding. This is your skin. They put the tape on top of that. In between there, you have scabbing starting to form. That scab is on your skin and sticking to the back of the Steri strip with the adhesive. What's supposed to happen is, as your wound closes and as the scab starts to heal, when you have a scab, it heals and then it falls off your body, right? So that Steri strip, the scab is supposed to fall off, and the Steri strip, naturally, the adhesive wears off, and the Steri strip, as your swelling comes down away from the Steri strip starts to lift. So there's 3 parts that we're talking about here. 1, we're talking about the adhesive on the Steri strips. 2, we're talking about the scab that's stuck to your body and stuck to the back of the Steri strip. And 3, we're talking about your actual swelling that's pushing against the Steri strip, holding it with that pressure, the swelling coming down and that strip loosening up. So there's 3 parts to it. So 1, getting the swelling down. So let's say you're using Dial, Dove, or HiPoCleanse. Ew. I have tons of videos on why that's bad, and you should be using the post-op soap, which you can get in our online shop. But let's say you're using Dial Dove or HiPoCleanse. You are drying out your skin. that adhesive is going to stick because it's so dry, and it's going to get stuck right on your skin, and it's not going to lift properly. So that's number one. Number two, if your wounds are not healing properly because you're so swollen, or you're in a binder that keeps cutting into your incision, you're going to keep bleeding onto that Steri strip, and it's going to keep sticking there longer. And number three, the swelling. If you are so swollen that you are pushing against the Steri strip is going to have so much pressure behind it that getting it off is going to be horrible for you. So with Steri strips, with all these little like strip things and glue and all that, if you have a surgeon that's here in New Jersey or in your state, generally when you go in for your post-op, they take that off, and either they put a new one on or they just take it off and leave it to see how it's healing, whatever. That's your surgeon. So that's all that. But this video is for you guys who have no idea what's going on. You have no access to a surgeon. You have no access to anybody to help you with any of this. So with that whole Steri strip glue situation, we're going to talk about the glue in a second, but that's Steri strip. You need to be using a proper post-op soap. Using Dial Dove or HIPAA Cleanse is going to dry you out like crazy, and that adhesive is going to stick to your skin a million times harder because it's a drier surface. So that's going to cause a problem with trying to get it off. It's going to be extremely painful because your skin is so raw from the Dial Dove HIPAA Cleanse that you're using that's drying you out like crazy. Number two, if you pull it off too early, if it does not start lifting on its own, you are going to rip scabs. Guys, nowhere in this video at all am I telling you to take off your Steri strips. I'm telling you the opposite. They should be coming off naturally. You should not be ripping off anything off of your body. You should not be taking out your own drains. You should not be taking out your own stitches. You should not be ripping off your own Steri strips. No, you are going to bust something open. Do not touch it. Period. It's supposed to come off naturally. And part number three, if you are in a binder, like I said, that's cutting into you, causing that pressure, causing that blood to stick to that Steri strip even more. If you are in a garment that's too big and you're really, really swollen, that Steri strip's not going to come off the way it's supposed to. So again, as I say in every video, making sure you have proper compression, a proper garment that's not going to cut you, but is actually going to hold you properly so your swelling starts to go down with using the Amare Lipo foams to get that swelling down so that area starts to come down and the Steri strip starts to lift naturally. So that tape, the Steri strips, that stuff should be coming off your body naturally as you heal. That's why the doctor doesn't always take it off and they say just leave it. That's how that works. Do not pull at your strips or tape. Last time I'm going to say that. So, when it comes to glue, some doctors will use glue to seal you up instead of like stitches or something like that, depending on how your skin is, depending on what their work is, their incisions, blah, 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 blah. So with that glue, and I'm not talking about from the tape that they put on you where the gauze was, I'm not talking about that glue that stuck to your skin. That, again, if you have glue on you still, and it's been like 2 weeks, if you're still sticky all over with the glue from the tape, from gauze and stuff like that, your skin is a mess. You need to be using the post-op soap and get that stuff off of you so your skin is healthy and breathing and clear so it can heal properly. So anyway, if you've got that sticky stuff on you still, get yourself some post-op soap from the Amare post-op shop, link in bio. Anyway, so glue. It looks flaky. It looks like glue. It looks discolored. You might think it's scabbing. It's not. It's glue. Ask your surgeon what they're using on you and ask them how to take care of it. That is the best thing that you could possibly do. Because you don't know if you have dissolvable stitches. You don't know if you have glue. You don't know how to take care of your Steri strips. If they want to take them off or if they say let them fall off naturally. Either way, if you have glue, if you have Steri strips, if you've got stitches, that's a wound. It needs to be taken care of properly. You need to be using the proper soap. You need to be using wound care. Here's the other thing. So we talked about the glue. We talked about the Steri strips or the tape, right? And then, of course, if you have stitches, I have a whole video on how to take care of your stitches. Belly buttons. Your belly button. Sometimes they will put anchor stitches in there that they have to remove by them, like the doctor has to remove them. They have to be actually taken out. Sometimes they will use, well, 90% of the time, they'll use dissolvable stitches, which those heal on its own, so you don't touch those. Here's the thing. They'll give you an antibiotic ointment. I just did a video on this. They'll give you an antibiotic ointment. That antibiotic ointment is not going to help you dissolve your stitches faster. That antibiotic ointment, or if you're in Miami, the powder that they give you, yeah, that's not going to help you heal faster. a lot of times that stuff is gooey and thick and wet and will sit in there and it'll get gooey and thick and gross and you need to be cleaning it out. Some doctors, again, I cannot speak for your surgeon or your surgery or anything specific, but some doctors I've heard will say use a little bit of peroxide on a Q-tip and just clean it out, dry it out. That's fine. And then you put the ointment in there and guess what? It's wet and gooey again because that is a crevice where moisture is going to sit and you're in a garment all day holding everything in. So using the wound care, again, in our post-op shop, you can mix that wound care with your antibacterial ointment, your antibiotic ointment from your doctor, and put that in there. And the antibiotic ointment will still stay in there to get rid of all the stuff, the germs, and so will ours. But ours will help coat your stitches and coat your incisions to make sure that they're healing properly, not just not getting into trouble with the little bad guys, the microbes and infecty things. So making sure that you're actually being proactive about taking care of that incision. Because guys, the biggest thing I hear is, I don't want to do a tummy tuck, I don't want to scar. If you take care of it properly, you won't scar. Scars, think about when you get a bad scar, right? When you have a bad scar, it's from a bad cut. If you're getting a surgical cut that's nice and thin and a nice line, and you're making sure it's healing properly and not swelling so it's not destroying the tissue and destroying the incision as it's trying to heal, and not getting squeeze massage, which I'll do a video on later in the week, that whole rant, because I posted an article about it on our timeline. You guys can go check that out and how squeeze massage ruins your incisions and causes fibrosis and seromas. But with that being said, making sure that that area is treated, that skin is treated, even with the Steri strips on, even with all of that going on there, even with all the stitches in your belly button. Being proactive and taking care of that, it's what's going to save you when you come home and you don't have the doctor out in Miami anymore and you're like, I don't know what the hell to do now. So making sure you're being active about this stuff. Now, with Steri strips. So, very, very big thing. When your Steri strips start to lift, they don't always lift from the ends. Sometimes, depending on how they put them on, they might start lifting from the middle. You still have incisions that are trying to heal under there. You're in a garment all day with your sweat and your oils from your skin and all that stuff. If you guys aren't cleaning at the area around your Steri strip or cleaning your Steri strip itself, usually after like week 2, once you get your drains out, they say you could take a full-blown shower. If you're not making sure that that area is clean, it's going to get gross and it's not going to heal right. And think about it this way. If you have any little lint particles, I know that you won't, but if you have any little lint particles, right, or any little dead skin particles, that stuff is adhesive. That stuff is sticking to the adhesive of the Steri strip, which is on your body where there's a wound. Gross. So I can't speak for anybody else's wash, but with our post-op soap, our post-op body wash, it's a foam. It's not like a gel where you have to rub. You're not putting any pressure on the area. You literally take a handful of the foam, you pump it in your hand, and then you just blot it onto your Steri strip. And then you just wash it off with water. And that's it. It'll make sure it gets clean. It'll make sure that there's no like dirty debris. There's no like built up blood under there or anything like that sticking to those pieces of the Steri strip. And everything stays clean and everything stays calm. So making sure you're actually doing that. Same thing with your belly button, right? The belly button incision. How do you get in there to clean that in the shower if you're using like a liquid soap dial thing? You got to stick your finger in there. Ew. I know nobody wants to touch that and it's super sensitive after a whole tummy tuck thing. But sometimes you don't feel anything, which could be even worse because if you're taking a Q-tip and you're like jamming in there trying to clean it, you can't feel anything. You can be doing so much damage and not even know it because you can't feel anything. So again, with our soap, take a handful of the foam, pack it in there. And then just run a little bit of water over it. Make sure it's clean. Make sure the incisions are calm. Make sure there's not anything getting trapped in there and causing, any bad stuff to happen. So again, handful of the foam, pack it in there, let it, do its soapy thing, and then just wash it off. And that's it. Don't touch it. Don't poke it. Don't try to clean it out. Don't do any of that. And guys, for the love of God, stop sticking foreign objects in your belly button. That is not how that works. Please, I'm going to say this one more time because I do have it in another video. Swelling in your belly button, you're not going to get that out by sticking a marble or an earplug in there. That is, no. Your swelling will come down if you're getting proper manual lymphatic drainage. If you have proper lipofoams in your garment, you're not using a board or anything like that, that's hard trapping fluid. And if you have a proper garment, the swelling will come down naturally. Your body will suck that swelling back and you will pee it out. That's how it's meant to happen. And it happens way quicker than sticking a marble in your belly button for 3 weeks. because ow and ew. Again, unless you guys, and I know they don't tell you this. They just say, put a marble in there, or put an earplug in there. I know they don't tell you to wipe that thing down with alcohol before you put it near an incision site. And I'm pretty sure 90% of people don't do that, which if you're going to be sticking things near an incision site, you want to make sure it's clean. Pretty sure that's not happening. You guys are probably just a little soap and water and stick it in there, if that. So again, please stop putting things in your belly button. It is not helping you. It is not doing anything for your swelling. All it's doing is clogging up an incision site that's trying to heal, that needs to breathe, that needs to heal. Even if your stitches are dissolved and you're 4 weeks post-op or you're 6 weeks post-op tummy tuck, putting a marble or something in there is creating pressure and you're trapping fluid. It's not giving it that circulation that you need. I did a whole video on my lipofoams talking about the circulation that you need in your body to get your lymphatic fluid to flow so that that swelling can start to move and get back into your body and get reabsorbed to be processed out. If you're blocking it up with things that are hard, like an earplug or a marble, that swelling is not going to go anywhere. It's just going to become hard and thick. And that's why you see some people with a belly button that looks hard and plastic, is because you're trapping all of that fluid in there. It's becoming sedentary. It's congealing and becoming thick and becoming scar tissue in that scar belly button area. So yes, you may be molding it, but you don't want to mold it. You want it to be soft like Play-Doh. You don't want it to be like hard, dried out, molded Play-Doh. You want it to be soft, squishy, natural Play-Doh. That's what we're trying to keep it at. So, Steri strips, we know how to take care of those. Don't touch them. If you can consult your doctor, consult your doctor. If you can't consult your doctor because they're in Miami or they're not answering or whatever, just leave them and let it fall off your body naturally. Make sure you're cleaning it properly with the post-op soap. Make sure that if you have wounds, you're treating them with the wound care, like in the belly button, to help those stitches dissolve faster so that you don't scar. Now, when the Steri strips come off and when you have not really any like stitches, spitting stitches is basically where you have like the knot of the stitch still, or like a little piece of a stitch sticking out. If you're not spitting stitches, and if you don't have any scabs, if it's like skin but it's still raw and kind of red and like pink and not really like flat, like this is a scar that you would use scar cream on. It's completely flat. You can't see it. I mean, I'm not using anything on this, but I don't know if you guys can see it. It's flat. It looks like normal skin. It feels like normal skin. It doesn't feel like a fresh scar, right? Do not use scar things on your tummy tuck until you are at least 3 months out. Because again, all of that stuff, those silicone products, and we have a wonderful 100% silicone scar stuff thing. What am I trying to say? Scar ointment. We have a wonderful one. There's nothing else in it except silicone. It's 100% pure grade and it works. Now, you don't start using anything on anywhere of scarring, skin, anything like that until 3 months post-op. I even say this for lipo people because that swelling pushing behind your tummy tuck scar, all of that fragile skin that's not healed yet, when you start putting stuff on top of that, again, you're going to compromise that tissue that's trying to heal. The same way by using really wet, thick antibiotic ointment or something like that. You want to make sure that that's dry and healed and not pink and not still like looking a little bit raw, like the scabs just fell off a week ago or yesterday. You want to make sure that skin is actually ready for scar treatment. So when it comes to a tummy tuck, I usually say wait 3 months, then start using whatever scar treatment you want. If you want to do laser treatment, if you want to do an ointment or some kind of something or other treatment, you could do whatever you want. Just wait 3 months. Wait till all that tissue is fully healed. Wait till you've done your sessions with us and you're fully done being swollen and fully healed with that. Wait until everything calms down before you go putting things on your body again, beating it up, putting it through more treatments. Because a tummy tuck is a very serious thing, guys. And taking care of that incision is a very, very serious thing. Because the last thing you want, which is what I've seen, is people busting open because of swelling, or on the sides here when you wind up with the dog ears because you didn't get a proper garment, and then you were doing all this crazy rubbing massage causing a pocket of fluid, and then you got to go back for a revision. Guys, one and done. We want one and done surgery, so let's make sure we do it right. So again, Steri strips. This is pretty much what this video was about, was taking care of the tummy tuck incision. Steri strips should be falling off naturally as the swelling comes down. You want to make sure you're cleaning it properly. You want to make sure that you're checking it, making sure that you don't have any excess blood like around the outside, just sitting there, hanging there, making sure that everything is healing right and clean, healing clean, making sure your belly button that all of that in there is clean, actually looking at it. I know it can be really gruesome, guys. I know it can be really scary for you, but really, really, really please try to make sure that you're keeping a check on your incisions and stuff like that. And if you guys don't want to, set up a virtual with me and I will. I know I have clients who literally just set up virtuals with me just so I can look at their incisions because they don't want to, which is totally fine because I can keep you on track. But you have to start taking care of these things. And again, if you're unsure about your Steri strips or your glue or something like that, set up a virtual with me, 732-841-0142. If you need that post-op soap to clean your Steri strip area. Guys, even with a breast aug, even if you have Steri strips on a breast aug, or if you had implants and you've got the Steri strips going on, or you've got a lot of stitches everywhere, make sure you're getting the wound care. Make sure you're getting the post-op soap from our shop. The link is in the bio. I will also put it in this video. And if you guys have questions about this, if you're not sure and you're not really getting the guidance that you need, set up a virtual with me, 732-841-0142. Alex can help you get set up and we'll figure it out. But just don't go pulling things out of your body. Don't go ripping things off. Don't try to rush the process. They say trust the process. It's hard to do that when you have no guidance. So I'm giving you guys guidance so you know to trust the process and how these things are supposed to work. And if your Steri strips have been on for more than 4 weeks or more than 3 weeks, and if your doctor didn't tell you what to do with them because you're coming from Miami, and if you're not sure because it looks really gross and they're still really stuck on there and you've got like glue all over your body from all the other stuff they put on you, set up a virtual, buy the post-op soap, buy the wound care, and we'll get you fixed. So guys, I will talk to you soon. My next video I will be doing on the whole squeeze massage situation because I realize I don't have one dedicated to just that. So I will see you guys soon. Have a good rest of your night. Bye!